Secretary of Health and Human Services, Tom Price, is with us this morning, and he declared a public health emergency in response to Harvey. The department sent an extra 53,000 pounds of medical equipment and supplies to the affected area. It has more than 500 people on the ground helping those in need. Secretary Tom Price joins us from FEMA headquarters in Washington, D.C. Secretary, good morning.
Good morning, Norah.
What does this declaration do in terms of being able to get the right kind of medical and health treatment to those here in Houston?
The declaration is incredibly important because it allows us the flexibility to respond when the local city, county, and state officials need assistance. So whether it's in assisting transporting patients, whether it's in making certain that we have the pharmaceutical caches that are necessary to restock the pharmacies in the area, all the kinds of things that make it so that we can attend to the health and well-being of individuals in this incredibly historic disaster, catastrophic disaster that we're seeing right now.
Harris County's public hospital had to evacuate, shut down. A lot of the evacuees that came in here that I talked to last night, one of their concerns was, I didn't have time to get my diabetes medicine. How do you address those health concerns?
Yeah, they're addressed locally initially, and there are about a number of pharmacies that are closed, but there are over 2,000 pharmacies in the area that are indeed open, and the vast majority of those continue to have power. So if it's a chain pharmacy, then those individuals ought to be working through the chain. Otherwise, that'll be contacting the local officials, the emergency officials there, if they're not able to get their medication. This is incredibly important for people to be able to have access to the kind of medication that they need, and to try to increase the cachet that they have on hand so that they're able to weather the storm.
Secretary, I'm here in Houston, but my colleagues are up in New York, and I'm going to bring in Margaret Brennan here, I know, who has a question for you. Margaret.
Thanks, Norah. Mr. Secretary, would you urge Congress when they come back not to cut funds to FEMA and to actually look at boosting emergency funding?
Well, thanks so much. We continue to be in the rescue phase, the life-saving phase of this. I think that the sense of Congress when they return will be to focus their attention on this, obviously. But right now, we're concentrated on the individuals on the ground. There continue to be folks that need to be saved, that need to be assisted in their health needs and their human services needs, and that's where we're focused right now. The good news is that we pre-deployed through Health and Human Services more individuals prior to this disaster than ever in the history of HHS. That means that we're ready and able to be able to respond to the needs based upon what the local city, county, and state officials need.
Okay, Health and Human Services Secretary Tom Price, thank you very much this morning from Washington.
Thank you.